ठीक है तो यहाँ बैठ जाओ। हम्म,
Kalau rasa kan, ini mana orang berapa orang berapa
हेलो मिसेस पूनम।
Yes, ma'am. Very good morning, ma'am.
गुड मॉर्निंग।
Good morning, Roy, sir.
Good morning.
Ma'am, very good morning, sir. It's our pleasure to have you here with us. In spite of busy schedule, you have taken time. We are very much honored with your presence, sir. Alka, ma'am, can we wait for 2 to 3 minutes?
Okay. I'm
Candidates are joining, ma'am.
okay.
Okay.
Sir, what is the condition in Kerala?
Mm,
Bad.
getting bad.
Yeah.
Number of cases are going up because we
Yeah.
almost 3 lakh people came back from different
Yeah.
countries,
Places. Yeah.
India, Middle East, European countries, and the viral load is high, and the contact
Yeah.
cases are increasing. And also, we have started getting cases where the contact is not known. So it is
Okay.
an indication of a social spread, mild, though it is not widespread, it's in certain particular places, clusters, but that is causing worry, and the government is preparing to have more first line treatment centers.
Okay, sir.
So that type of, because those who doesn't need a hospital admission, they are planning to have community centers where first line treatment is given. So
Hmm.
that way they are trying to manage, but it is really worrying because people are coming every day. Their planes are landing with the party.
Yeah, people are coming from outside. 6 months is going to complete now.
Yeah, yeah.
Yeah.
It is going to be, definitely much more.
Yeah, it will be until we get the vaccine.
Yeah, yeah. Then we start coming down.
And awareness also. The people are not taking at present also seriously.
That the initial caution has come down. People started moving around freely and things like that, as if it won't affect them.
Yeah. Still, then if we go somewhere, then see the people are not using the mask and all.
Crowding around, people trying to crowd for whatever, it's a market or a fish frying place, wherever people are crowding.
Yeah.
It was much guarded, people are guarded, but that guard are gone now.
Yeah.
The novelty has gone, they are back to normal in many places.
That is our topic today. What we can do. That is thing. That's what. How can we help them?
Yeah, Alka ma'am, can we start now?
Okay, I'm ready. Sir is
Uh,
also there.
Okay, okay. Thank you, ma'am. Thank
Okay,
you.
thank you.
Okay. Please carry on.
Okay, good morning. Uh, like it is well said that good health is a good sense. Good health and good sense are two of life greatest blessing. And health is a state of complete harmony of body, mind, and spirit. Now we just see that these are the two quotation I've just quoted here. Now we see the importance of this. Good morning to all. Principal of various College of Nursing, teachers, dear friends and students. I extend my warm welcome to series of webinar organized by Nursing Teachers Association of India, Gwalior Zone. I appreciate all of you taking time off your busy schedule to join us today. We hope you will enrich your knowledge a lot. First of all, I thank to organizer for giving me an opportunity to moderate today's webinar. I'm Dr. Alka Saxena, Principal Case Nursing College and Joint Secretary NTA Gwalior, Nursing Teacher Association. It is my immense pleasure to act as a moderator for this morning session of the series. The topic for today's webinar is Professional Nursing Organization association and pandemic situation. As you see in India, yesterday I just looking that 27 20 with a record of total there are 11 lakh cases and 40,000 cases increasing in 24 hours and near about 28,000 that till there. Although there is 62% recovery rate is there, we have some hope. How can we just reduce this by our efforts, by our leaders in the nursing association, nursing profession? So as I know that Indian Nursing Council, this is association organize so many webinars for helping our ANM nurses and at all level for creating awareness and how can do they provide their services in the local area in their setting where they are working. So since starting we have so many webinars arranged by the Indian Nursing Council, and other we are arranging like colleges and state nursing council are also helping to improve this condition and creating the awareness. I have the honor to introduce our today's speaker, Professor Dr. Roy K. George. He is the academic director and principal, Baby Memorial College of Nursing, Kerala, national president, TNI. Dr. Roy have very big 3 4 pages or more than have experience, very long, very good experience. And I would like to tell you in brief, Dr. Roy K. George worked at various positions such as Regional Director of School of Medical Education under Mahatma Gandhi University, Kottayam, Kerala, Director of Nursing, MG Hospital, and Principal of Theophilus College of Nursing, Kottayam, Kerala. Many other years of experience, very good experience he has. Dr. George attended numerous national and international conferences and allied field as resource person and delegate, completed many research projects. He has published more than 30 publication in national and international journals. Dr. George is founder, editor, publisher of a scientific journal of nursing in Kerala. He authored 2 books in nursing and PhD guide and PhD educator in many universities. He is a controller of entrance examination for the admission to all private college of nursing in Kerala. Dr. George has major role in professional association, TNI related activities such as under his leadership, Kerala became the first state which implemented the new scale based on Supreme Court case, and founder editor of Kerala Nursing Forum published by state branch of TNI. Many more leadership activities we can see in his resume. Dr. George proved administrative skill as principal of nursing college. He's also enrolled 100 to 200 members annually to TNI since many years. One thing I would like to see, welcome sir on this webinar, and please enlighten our all the members, all the participants. We are just waiting for your enlightening talk today. And one thing just I would like to tell you that you can drop your questions regarding topic in the chat box, and please mute device so that the speaker will be able to continue their lecture without disturbance. And without further delay, I would like to invite Dr. Roy K. George to deliver his presentation. Sir, over to you. Thank you, sir.
Thank you. Thank you very much, Dr. Mrs. Alka Saxena, the moderator of this session, for giving a nice introduction about me. Thanks for that. And good morning and welcome to all the participants to today's session. And can you share my screen?
Yes.
Yeah. See, we are going through an unexpected and unheard pandemic in our lifetime. Maybe the last century had seen 2 major world wars. But even in that world wars, only a part of the world or not all area of the world was affected. There was no global war, actually, though it is called world war. Majority of the parts were affected, but it was one after other, or some area the war was over and some. But when this pandemic came, most of us who is there, seniors and juniors, have learned about epidemic, endemic, pandemic, things like that in the community health nursing. But none of us have faced a pandemic of this proportion. Any nursing professional who is alive now has not faced a pandemic of this proportion. It's a real challenge which calls for newer methods to combat. We are all hopefully expecting that the curve will come down as early as possible. But irrespective of all the efforts of the health fraternity, the number of cases are increasing in every part of the world. Except in places which had a peak, they are coming down, but it is rather a natural peak, downward movement. So before going into that, first of all, let me thank the organizers of this conference for inviting me. There are a lot of webinars and a lot of meetings going on as far as, because we are all turned digital. Moreover, there are a lot of information to be given, a lot of updating has to be done. So many were there. They were ready to adjust to the timing because Trainers Association of India is too busy with so many problems, many of that which we cannot actually settle immediately, but we are trying to. So thanks once again for the organizers, and I hope I will be able to throw some light on the role of nursing organizations in such a pandemic situation. So current pandemic situation is a truly global pandemic of unexpected proportions. The projections are changing, the protocols are changing, the treatment modalities are changing, and the way even the transmission guidelines, how to prevent it, have been changing every day. So it is very, very challenging. And as we know, it has already affected lakhs of people. Those who are affected are either under threat or under risk, or are anxious about getting an infection. And we have a major concern that this pandemic has affected health workers globally. And it has got a severe financial impact on the world economy, from the macro level to the micro level. Every institution, government or private, management or autonomous, academic or non-academic, everybody is affected. And generally the dynamic economic sector, the business sector, everywhere there is strong impact. And health professionals are at, or the professions which are dealing with health and wellness of people are at huge risk. So this is something which worries every human being. And as far as health, as far as we are concerned, the health professionals, we have a lot of concern because we are at the forefront of the battle. We are not equipped with any disturbance. Hello, we are not equipped with enough arms to fight the battle because we are also learning from the battle. Health professionals need a lot of support, and this is never before experience.
Sir?
Everybody.
Excuse me, sir.
Yeah.
Yeah, we are not able to see the screen, sir.
Oh. Why it is paused? 1 minute. I will share it once more.
Yeah, once more, please share the screen. Yes, now visible, sir. Now visible.
Okay.
From beginning, we can. Yeah.
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 So
Thank you, sir.
can you see now? Are you able to see now?
Yeah,
Yes,
yeah,
sir.
it's visible now, sir. Visible.
So, as I told, it is a true pandemic of unexpected proportions. It has affected every nook and corner against any without any difference of creed, caste, politics, or climate or geographical conditions. It is a truly difficult pandemic, and it has already affected lakhs of people, and it is still spreading only. Nowhere in the world we can say it is fully under control. Even in the areas where the initial control was success, in Korea or Thailand, there are second waves are come, and nobody is sure about whether the third wave is there. So it is really causing concern. And unlike many other diseases, it has affected health workers globally. Everyone, whether doctors, nurses, paramedics, or support staff, there have been people who are affecting and has caused death to many of the health workers. Even in India, we have lost more than 100 doctors and more than 15 nurses, and the numbers are increasing. Yesterday also we had a report from Gujarat, one more nurse died. And of course, the financial impact from macro to micro, from the global level to the local village level or the town level or city level, they are affected. Every institution, whether government or private, especially healthcare institutions, have been affected badly with the requirement of additional facilities, additional equipments, additional beds or additional physical facilities. It has been affected. And as we already told, financially as well as by disease-wise, health professionals are at large risk. It all increases our susceptibility to infection as well as susceptibility to tension and stress and burnout. So this is a very difficult situation wherein we have to. And initially it was like an alarm response. Basically, when in March, early March, the highest office in the country, the Prime Minister also called for a meeting of the health professionals associations, a video conference. Truly telling, at that time, none of us who were called for the meeting also didn't expect that the pandemic is going to be such a huge proportion. But still, we were able to put forth positive suggestions for managing the battle. And so mobilizing the professionals for the battle was first thing which the government tried, the management tried, and the professional organizations. And from our side, from the professional organization, TNA was the first one to put the proposal of insurance for health workers, which was immediately accepted. The very next day, the orders came from the government of India. So there was an initial mobilization. Then next tough task was upskilling for the new situation. As the moderator told, the disease is quite new. The way we have to fight an infection is quite new, because generally in any healthcare setting, infectious disease is a small area. Either many of the hospitals do not have an infectious disease unit or a isolation ward also, because we are so much bothered with other medical and surgical conditions like maybe cardiothoracic or neurosurgical or pediatric or OB/GYN. There are so many specialties and super specialty in that infectious disease was always having a backseat, especially in the corporate sector, other than the teaching institutes or large government hospitals. So there was a lot of need for upskilling, how to wear a PPE, where to get a PPE, and how is the proper method of donning and doffing of, how to prevent it. But though we have all learned, especially because it's a nurses teaching conference, we will particularly focus on nurses. We have learned about infection control. There is hospital infection control units. We learn a lot about antibiotic resistance or liver infections and things like that. But many of us have never worn a full personal protective equipment, never in our lifetime or in our professional life. To be honest, I saw the first full kit personal protective equipment in TV or in media when Ebola virus came in Africa, or first day I saw physically with my eyes when Nipah struck Calicut, my hometown in Kerala 2 years back, how a full PPE kit is. So from the very basics, we had to upskill nurses for this battle, because nurses were called from all the specialties to be in COVID duty. And we had the risk of getting a COVID infection even in general wards or in the OPD or in the other areas of hospital or in the or outside. So this upskilling was a huge task. Of course, Indian Nursing Council, TNAI, and education institutions and other many societies of specialty organizations like Teachers Association or nursing institute, even trade unions have joined. But all these were, the alarm response, because immediately we needed some information on how to combat this battle. And next challenge was gathering information about the situation, what is going on in every part of the country and around the world. Because the professional, the organizations has to represent to authorities, to the government, to the managements, we need information about situation. That was done as part of alarm response. And we had to provide updates on the situation. How many people are infected, how many health workers are infected, how many people are affected in each state, what is the trend, whether nurses are resigning and leaving the job, where doctors are. There are a lot of information which is coming. And of course, in this age of social media and information explosion, we have to judge whether the information gathered is right, what information we are getting. So this was all part of the initial response by the association. As well, being TNA president, I will be talking more about what TNA could do. We have started there was a lot of webinars going on by Indian Nursing Council and other agencies, other associations, but we have started conduct only 2 webinars. What we gave our more thrust was to having e-learning module for upskilling, because upskilling is a tough task and nurses have to get time to finish. Attending a webinar or maybe in YouTube it is available, but many times it do not happen, and there are convenience of time, things like that. So we thought an e-learning module which can be, they can go do it at their convenience. So we have successfully launched a upskilling learning module in the TNA website, which is already crossed 40,000 mark. 40,000 people have used, done it, and have got the certificate of. And this is a e-learning module with proper videos, well shot videos, which are very clear, very basic, simple explanation, which everyone can get. We had English version. Now we are going to upload the Hindi version also for people in the remote villages. And so many doctors also, though it was upskilling for nurses, so many doctors have done the course because they found it very useful for the basic upskilling. And this gathering information and providing updates on situation is going on a day-to-day basis. While we going into the next part of discussion, we will see what all things are being done. And common issues faced by nurses in the beginning, many of them are still continuing. First one was lack of enough personal protective equipments, and many places did not have a stock of full PPE, even N95 mask or FFP mask or mask which will ensure protection of a health worker from a viral disease was not available in many places. It was huge deficit in many parts of the country, and health workers were alarmed, and most alarmed group was nurses, because we were having most large or extensive contact with the patients. Those who are diagnosed with COVID positive, or even those people who are undiagnosed who are coming for other medical help. So at that point of time, government was trying to, and that time PPE was not even manufactured in India much. Very few companies were manufacturing, and government was trying to import. And in DNA, we faced that, we realized that by the time the government supplies come, we have to provide an interim relief. So we had set out into the battle, and we could procure and supply N95 masks and surgical masks to most of the parts of the country through TNA branches, because till the other supplies come, the government supplies come, we need to protect nurses so that we have to minimize the damage. That is what we have done. Same time, we were representing with the government and also with the managements in various parts of the country to ensure that proper PPE is supplied. There was sort of difficulties in getting it, and distribution was controlled by somebody other than nurses. For the distribution of PPE, it was opposite was posted. There was a lot of hesitation by certain places and certain authorities to supply it, like trying to minimize the situation, or just to say that this is no need of PPE, we have to just take hand washing, things like that. There were a lot of issues, but that was a major issue we faced. Next is lack of administrative support, because our system was not geared up initially to manage such a huge pandemic. There was lack of essential support, official as well as administrative support, and lack of essential facilities. Even the many places, even the premier institutions, there was not, other than a usual nurses changing room or doctors changing room, there was no facility to don the PPE or take off the PPE and ensure that they don't get infection while donning or doffing, especially in doffing. So such facilities were lacking. Facilities for transport of nurses safely, especially during lockdown, was not available. In some of the hospitals, nurses or health workers were packed into ambulances, and that itself was a source of infection. So that sort of, and there was no facilities when the quarantine was implemented for the nurses, especially those people who took care of patients for 14 days. They were asked to go in quarantine. Quarantine facilities were very poor. They were not having any adequate, safe accommodation and decent food. There were issues. So there are a lot of essential facilities. And next was, to add insult to injury, was salary and financial issues, especially in many private sector. hospitals. Salaries was not disbursed in time. There was salary cut, and even there was threats of losing job because other in many places other than COVID patients, now the patient turnout came or patient footfall came down drastically, and they had salary issues and financial issues. Of course, there was financial issue at the hospital, but it was not a reason to demoralize nurses and withdraw support for nurses at that time, because they are the people who are to be in the battle ready. So there were such issues, and family and social issues for the quarantine nurses, for a potential source of infection. And for 1 or 2 weeks, it's easy for nurses to be away from home and stay in a quarantine place. But when it is extended without any idea of when it will come to end, there was family issues, there was marital issues, there was intra-family issues, and even community issues, where people tried to isolate nurses or doctors because of fear of infection. That was initially, but later changed. But there was such issues, and still there are issues reported from many places, small issues, which has got a large impact. Of course, continuing stress, psychological as well as physical stress on work, and burnout is a common problem faced by nurses who are in the COVID battle. The psychological stress is too heavy, and how to handle it, in addition to the physical strain of taking care of patients and being in quarantine and practicing the infection control guidelines. And resolving problems faced was very difficult, and gathering data on problems faced itself was difficult initially, because there was no such active channel for a national data gathering, and we had to activate resources from our own resources, association resources. We have used a good amount of nurses welfare and disaster relief fund for procuring PPE or supporting nurses. And even we were about to arrange transport of nurses, like in Mumbai and Delhi. Many nurses who resigned before COVID came, who had been relieved from hospital and were no place to stay, and they had to go back to their home places in Kerala or Tamil Nadu or Karnataka or Orissa. There were so many nurses stranded. We were arranging transport them, because the train service was stopped, the flight service also was stopped, and they had no places to stay also, because they had vacated the institutional provided accommodation, and new nurses were recruited. Such issues were there. So activating resources was very important to support nurses at that time. And listening to grievances, because I used the term listening to grievances was very important, because many of the grievances were not easy to solve. There were multiple issues which caused the issues, but at least as an organization, nurse organization should have a facility to hear the grievances and trying to settle as much as possible. And at least the feeling that there are somebody to hear the grievance also was important at certain point of time when the tension was so up. So we have started a grievance cell, and we had thousands of complaints coming in from every nook and corner of the country. Many of them were solved completely, some were partly completed, and some were still being addressed, because there are difficult situations where immediate is available at hand. We need government support, we need support of management, other professionals, things like that, but still it is going on. Irrespective of that, as untoward incidents have happened, tragedies have occurred. In addition to death of patients due to COVID, there was a very sad case of a suicide by a nurse in Delhi, in Gurgaon, on hearing the news of COVID positive. Such things are happening, but through counseling and support, we could at least prevent such more tragedies later and mobilize a support system. And of course, motivating and supporting nurses is very important, because they are in the middle of a crisis. They are stressed. They need support. They need motivation. We need to tell them that all the country is with them. In addition to governmental or public support, we have to ensure that support is forthcoming for them. And when we have offered quarantine facilities for nurses in the TNA guest house, and both in Delhi and Noida. But because the policy was changed, that quarantine thing is changed, we are not able to utilize it, but we were there. And of course, promoting peer support, nurses who are working with them. They have to definitely support nurses who are working in the COVID area or non-COVID area. There are situations in places like Delhi where nurses were more fond of doing COVID duty, because the supplies were less in the non-COVID areas like masks. So we have to intervene and ensure that such problems are not there, and nurses are supported in that area also. And logistic support, providing equipments like PPE, that is ensuring the provision from the management or government, and same time supplementing wherever there is lack of support. That was something. Then financial support. We had to financially also support certain nurses who were as part of welfare measures or because they had critical illness which needed treatment support, and support for safe quarantine and treatment, and handling day-to-day problems. There are numerous problems like transport issues, and in between nurses were assaulted in some places due to misidentification. People were blocked by police in many places in Delhi and many parts of eastern states. So there were issues which needed day-to-day handling. And of course, when the temporary appointments of nurses came, the salaries were very low. Because we have a Supreme Court judgment that even in private sector, the minimum salary has to be 20,000. But when the government notified in Mizoram, in Tamil Nadu, in many places, this happened. We had to intervene. In some places we were able to correct, some places still the effort is going on. And of course, support for a safe quarantine treatment, we have already told. These certain issues which could be handled just not because of one association. We have got support from specialty organizations or trade unions also of nurses, and also managements or good Samaritans. In Delhi, like we got support from associations of other states like Kerala Association, Tamil Nadu Association, people who have helped us in identifying such difficulties and helping them, and they also mobilize support. And in addition to support nurses, many times we had to give support for other people who are in the COVID work, policemen, other health workers who needed personal protective equipment, or at least minimum 3-ply mask or an N95 mask, and providing food and support or water, water for drinking when they are on duty in the outside or on the road or in public transport. Such things were there. This all were, and in addition to our usual duties of public education, educating public what it is, and what to do and what not to do, and in this difficult time. And lobbying with policymakers was a very important area for our association, a professional organization, because one way we had some opportunity. This is the International Year of the Nurse and Midwife. We were planning of many grand celebrations which were abandoned in between, but we used that facilities to present our problems to the policymakers, to the health minister, to the prime minister, to the central health minister as well as prime minister, and also to the authorities in the Central Ministry of Health and Family Welfare, issues which are faced by nurses and what can be done and what are the long-term solutions. And as aptly said by the International Year of Nurse and Midwife, investing on nursing. And this is the investment in the health sector in India is very low. If we take in terms of GDP, it is too low. And this is an occasion to raise the issue because we need more equipments for a battle of this proportion, a health battle. The same way the army is strengthened to prepare for any war or any eventuality, health system has to be more prepared. And it showed the current pandemic has showed lacking in the system, deficiency in the system, or weak points in many parts of the country and in both in the government and management. So this is an occasion to present our issues with the policymakers at all levels, whether it is ministers or such people, or the health secretaries, or the administration, or the managements or corporate sector. And we had to negotiate and meet managements many times to ensure that nurses are taken care of. To a certain extent, we have been successful, but there are still problems to be addressed or settled because there are issues which are too extensive and to solve at different levels. And representing the concern, whether it is nursing councils or whether to the state health ministers or health department, it has been done. And ensuring media and public support was a very important area because this type of issues, media is a very powerful weapon for the state. So establishing contact with media and projecting nurses adventurous work and the support they need. And we have been successful in focusing media attention in many issues, but still long way to go. And before concluding, let me say we had a lot of people in nursing at different levels who were always ready to help the association by sparing their valuable time after COVID duty, after their normal duties, especially those nurses who are working in the clinical area. And of course, from the academic area, also we got support in preparing the upskilling module. And actually, the TNA was planning to launch the learning management system, the software, by the end of this year as part of Indian International Year of Nurse and Midwifery. But we had to rush it and launch a e-learning module because the pandemic has come in such a large proportion at such an unexpected time. So we had to rush in that we got support from people. And also we have taken the students also in helping people to educate people, public, about mode of transmission and how to prevent things like that, and supporting the full healthcare force by our own means, volunteering to work. And there are many places where people volunteer to help hospital authorities or where there was a shortage of people, nurses and doctors are moved. And recently, just last week, we were attending a Zoom meeting on impact of COVID on health professionals. And many hospital managements were happy to say that in many places, there was shortage of people. But irrespective of that, no nurses have left job during this crisis. None of them resigned or none of them abstained from duty. They were all praised for nurses, whereas in a single group of hospitals, this what they have lost. They have had case of 40 RMOs, President Medical Officers, junior medical officers, abstaining from duty, even after counseling or contacting them physically or by digital means. They refused to come for duty, but none of the nurses abstained from duty. They were all praised for nursing profession because though there was risk, though there are deficiencies, though there are causing problems like lack of salary or things like that, nursing professionals were there because we are trained to be compassionate. We are trained to help people irrespective of difficulties faced by us. And so, no, as a professional association, we had to use those such opportunities. See, nurses, irrespective of difficulties we are coming, don't think it as a weakness or liability of nurses. It is because their mindset is like that too, but we have to help them so that nurses, all the praise and good words for nurses shall not end with the pandemic. They need further support, further investment on nursing so that nursing service in this country will be strengthened to face any eventuality in future also. Like as public health expert says, this type of viral infections are not going to go one after that. It may come in future also because there are a lot of factors which is causing rapid spread of infections because of the changing world order. So we have to prepare our health system, and one of the major health, the more than 50% of the health workforce is nurses, and nursing has to be strengthened up to in accordance with the World Health Team and also the International Nurses Year team. Because investing on nursing is very important. So we are trying to make this an opportunity to trust this point or trust this point so that people in policy making level and implementation executive, the legislature and the executive also will help us to strengthen nursing, which will help to develop better nursing models and better nursing for people of the country, especially of this country, and of course, many of our nurses go out of the country, wherever they go. Nursing service has to be strengthened. The nursing as a profession has to be strengthened so that we will be able to provide better healthcare in future, and also nurses will have more comfortable methods of or more better facilities to take care of people, whether it is pandemic or not pandemic. So this all I have to say in brief because at 12 o'clock I have to attend another meeting which cannot be postponed. So anything I will be happy to clarify any doubts or hear any suggestions from the audience for the further activities of professional organization, especially TNA. Once again, thank you, the organizers, for inviting me to this session. Thank you very much. Madam, please unmute.
Thank you, Dr. George, for an enlightening presentation. We are grateful for the time and efforts you took to share your thoughts and experience with our audience. Since we are amidst of Corona-19 pandemic, your presentation were very timely and you have given the emphasis how the nurses can work together and solve the problem, how they are facing the problems and how the association can help them, like salary issue you have mentioned, and how they can mentally, by their mental peace and motivation, they can help to the pandemic. Long, thank you again for your contribution. We hope you can join us again. Now session is over for session is open for question and answer round, and I am sure Professor Dr. George would be pleased to answer your queries. Audience, Madam Poonam, any question in chat?
Thank you very much, Roy, sir, for the informative session regarding whatever the initiative TNI has taken to cooperate and to fight with this COVID-19 session. Sir, I just wanted to request you, please, you can provide some detail regarding that e-module so that our participants can also join that and they can upgrade their skills.
Yeah, definitely I will send the link in the WhatsApp to Kalka Saxena as well as to the Sabnam. And
Yes,
also,
sir.
in the TNA website, TNA online,
Yeah,
TNA online.
it is there.
LMS is shown there on the website itself. I will send the link also, direct link also. It is a free course. There's no payments, and it is a 4-hour course which you can take at your convenience. You can take over a single day, or you can take weeks to complete it. Each module by each session by session you have to go, and at the end of each session you have a test, and finally a final certification test and a certificate issues. I will send the link to you, Sabnam, and also you can just enter the site and see the learning module, learning management system (LMS) of TNA.
Okay,
Yes,
education.
thank you so much.
Okay, education is the most powerful weapon which you can use to change the world. In conclusion, I must say this information increased our knowledge to fight coronavirus. Dear participant faculties who have attended this session, thank you for your active participation in this webinar. Hopefully, the presentation will be beneficial for everybody. Take care of your body. It is only place we are living in that. Thank you so much, sir.
Thank you very much. Bye bye.
Thank you. Thank you, the team, for giving me an opportunity to work as a moderator. Thank you, Poonam.
Thank you very much, Roy, sir, and Alka ma'am, for your valuable time and well-presented session. We are very much grateful. On behalf of Nursing Teachers Association, I would like to extend my heartfelt thanks, especially to Roy, sir, as well to Alka ma'am also. Thank you so much. Greetings of the day, sir.
Thank
Thank
you.
you. Thank you very much.
Thank you, madam. Thank you so much.